Hi, everyone. I wanted to welcome the team at Solstice and thank them for joining us today. We're going to be talking about endo, and this is a nice sneak peek into our event we'll be holding in Long Island, where we'll have a little bit longer Q&A panel on endo and multidisciplinary care. But for now, I'd love to just dive in and whoever would love to jump in with the question. Solstice has 3 locations. Four. Westchester, Long Island, Midtown, and downtown Manhattan. So we're very, very excited to have so many of them here to be able to talk about endo today. But the first question, just to talk about multidisciplinary care for your point of view, could you just describe why endometriosis has this multisystemic impact and describe endo maybe in a just broad terms?
So with endometriosis, we know that there's tissue that's endometrial-like, that's inflammatory anywhere in the body, but mostly you see it around the uterus, the ovaries, the ligaments, the bowel. And so every time you have your period, right, and you're cycling through your hormones, it's going to inflame the tissue. And then with the inflammation comes pain. And then with that, it can make some of the muscles in your body tighter. So your pelvic floor muscles, your abdominal muscles, your back muscles. And then, every month as you're having your period and you're going through your cycle, it can just be inflaming it and causing the muscles to get tighter. And then it just continues on into this cycle where you could just end up having pain all the time.
And then management for that can include physical therapy, medication, surgery. So mental therapy, so it's important we're all communicating with where someone might be in their treatment, are they trying to put off surgery as long as possible? Did they just have surgery? So we're always, the PTs are always talking to the other care providers to make sure we're all on the same page of what's maybe best for the patient, what the patient wants at that period. So that's where that multidisciplinary approach to treating endo comes in.
It's so much more than just a bad period too, because I think that there is more recognition about endo than there used to be, but now I wonder if you feel like you're also educating beyond just the period, like Kara, how you were describing, it causes this widespread inflammation and back pain.
Well, it's interesting because some people will come to us for bowel dysfunction, and then endometriosis is something, well, for instance, bowel dysfunction, many other things, but endometriosis might be something that we bring up to the patient if they do have some other signs and symptoms, or if they're really not getting better, if their symptoms just don't really seem to be explained by the typical medical bowel issues, then we'll definitely have them get it checked out. So the period isn't always the first thing that comes up. So it's important to understand that too. It could be bowel or bladder issues, even sexual dysfunction. Or people could have hormonal suppression and be on the pill for ages, and maybe they don't have bad periods, but it's showing up in other ways. So I think it's important to look into that as well. Might be sneaky.
Absolutely. No, and Emma, you and Lexi both commented on that multidisciplinary approach, that you have to maybe bring in urologists or endosurgeons or, mental health counselors, many people, but also a lot of physical medicine doctors within this space too, because much more than a bad period.
Definitely. And the mental health support is so helpful, especially as people are learning about these new diagnoses. It's just so helpful for processing, for sure. There's so much that you do to help.
How do you see, maybe, because I can say from the mental health perspective, when we work hand in hand with PT, just the benefits that come from them and my clients feeling more comfortable in their body, less scared with movement, the mental health benefits and the physical benefits, being able to have intimacy with their partner again, right? These things are so valuable. I'm wondering if you see like from your side in your office, you see benefits when we're working hand in hand with the mental health side?
I think feeling like ability of like self control over their symptoms can help too. Like if they kind of understand from a physical standpoint like what they feel, and we teach them like how to manage when you feel this type of pain, but then also if they also are able to like understand and verbalize and like kind of manage their the emotional side of, you know, if they're in pain and dealing with a flare up and like care management of having endo is like really the full package. Those patients do really, really well.
Yes.
What I always tell people too is that like if your nervous system is heightened and you're stressed and like you also have endo, like it's just going to make every single sensation like that much more heightened, you know? So having stress or like life stress or anything else, like job stress, anything going on in your body is so inflammatory. And so like keeping that stress low is going to help the pain so much. It's not like a one-to-one thing. It's kind of like over time as your nervous system calms down through like the mental health therapy, you'll just notice such a huge difference.
It's also really validating when you describe it that way, because you're all saying, you know, there is a relationship to pain, but it's also not in your head.
Right.
But we cannot ignore the nervous system piece. So I think like we tie in a lot of dialectical behavior therapy, so two things can be true. So I think what you're doing is very validating and helping them have that dual experience, that stress can negatively impact your pain, and it also doesn't mean that it's not real. Like all of this is happening not in a vacuum.
Correct.
Right.
So true.
And then the other thing too is that most of these patients have been gaslit by probably multiple providers telling them they don't have endometriosis, the pain's in their head. Yesterday, a patient told me they were sent for a psych evaluation first for their pain. And so I think just, again, having the mental health support to like validate and understand what they're going through is really helpful.
And if you have people that are maybe nervous about coming into pelvic PT, I know, you know, when I have a client that I think would really benefit, it's really helpful when you have a relationship like with you guys that I can say, hey, I think, you know, just talking, you know, is going to be the first step, right? And knowing how trauma informed you guys are is so helpful, because again, you don't know kind of what they're walking in with what other doctors have said or done. But if you have someone who's a little nervous, is there things that, you know, I as a mental health provider can share just to kind of normalize pelvic PT, especially for endo, and knowing how important it is?
I think it's helpful when they understand coming in, like we're here to help and like to listen to them and you know, meet them with like what they're feeling and what their goals are. Like they won't come in and we won't be like, oh, these are the certain things you need to do to get to this. You know, it depends on each person. So like if they know that going in, like, oh, these people are here to help my physical pain and help, you know, me find patterns that help me feel better and that kind of stuff, like that's really what they're coming for and what we're here for.
Yeah. Like the patients are always in control of the session. So it's a lot of like back and forth, like, this is what I recommend, but what do you think? Or, you know, like this is this type of exam, but we could do it next time or maybe never, you know? And so there's a lot of different ways to treat these musculoskeletal dysfunctions. And, you know, there's external treatments, there's internal treatments if people are open to it, but it doesn't always have to be like internal work that is necessary. It can be helpful if someone's open to it, but it's definitely not necessary. So, you know, some patients I'm just doing exercise and stretches with.
I think that also that word control can feel very empowering, because with any chronic illness, definitely endo, there's an element where mentally things feel very out of your control. So if you're allowing them to have choice and agency within the session, that's really healing and helpful for their nervous system. I try to do the same thing of, this is a toolbox of third wave exercises, and you get to choose what you like. I'm not going to tell you what you like. You get to decide. So it's very empowering and does help, you know, find there is still areas of your life where you do have agency and control, especially in response to what's happening, which again, feels like it gets taken away a lot.
Yeah. And the best thing is like the musculoskeletal stuff is something that's a lot easier to control, it's really great.
Do you guys want to add anything, Georgina?
I feel like just like being there for them and like knowing that you're always in their corner and helping them through it is also really important, because a lot of these patients, they're very emotional and they don't have a lot of support around this. So us being there for them is just another person in their corner throughout this. Like how Kara said that they're gaslit by lots of doctors. Like we never want to be that person. So
so healing for them too, to feel like they have somebody on their team.
exactly.
Also, kind of going back to the symptom management component, I think a lot of them think it's going to be more physical manual therapy, and a lot of it is also, we just have a lot of tools in our toolbox. We see a lot of endo patients. We have a lot of ideas of what can help them with supplies and when to use them, and so a lot more goes into it than just the physical therapy component of it, and I think that is really helpful, because I don't think they find all of that in one place. A lot of the times they have to like run around or do research online, and so we are kind of almost like managing their care plan a little bit.
Yes, I always feel and say, I think pelvic PTs are the front line for so many, especially endo, but so many chronic conditions, is you're the doctor, the professional that they are seeing the most. And you do create that care plan. You're so hands on deck. So the work you all do is so invaluable. And I love that with those tools, like they can also feel empowered outside of session, that they don't necessarily have to wait to see you to get some relief or to do some things at home. That's very empowering too.
Yeah.
Totally.
Awesome. Well, if this conversation sparks some interest, please join us. My practice, my teammate Ariel, the wonderful team at Solstice is going to be hosting an event in Long Island in September. We have information on our website and also on our social media. But thank you all so much for taking the time to speak with me today.
Thank you.